Hello, my name is Sarah Wonsowski, and I will be speaking about COVID-19. As of March 11th, 2020, President Trump has concluded that the World Health Organization that the coronavirus, known as COVID-19, was classified as a pandemic. Across the nation, hospitals, grocery stores, and first responders have been at the front line of this terrifying pandemic. Within all of the myths about the virus, many people oversee how they can be called to action. Alongside with that, citizens get overwhelmed in the abundance of information that they receive from the news. Here today, I'm going to give you a brief summary of COVID-19. Coronavirus. Lots of people think that this coronavirus is related to the coronavirus. It's not. US Today journalist Tycho issued an article mentioning it found 38% of beer-drinking Americans would not buy Corona under any circumstances. Now, and 16% said that they were confused about whether coronavirus is related to the coronavirus. People believe that this is true because of the virus name and the beer name, because they both state Corona. What is the coronavirus? Coronavirus is a strand of the influenza DNA, and it has not come in contact with the human race before. This puts the medical field at a very big disadvantage. They're scared, they don't know exactly what to do. Who is affected by this? The people who are affected by this are elders of the older generation, people who have an underlying medical condition, and kids. What are the symptoms of the coronavirus? Symptoms of the coronavirus are fever, tiredness, they have a hard time breathing, and just feeling tired all the time. With this all going around on the media, this is creating a panic. As the government keeps putting limits on places to go, customers fear that they will not be able to reach a grocery store. This making them scared, thinking that we're all going to run out of food. CNN business writer Rainer Bronner had stated, as Americans grow more nervous about the implications of the global pandemic, and as the government puts extraordinary limitations on public life, customers across the country have been clearing supermarkets. I work at a supermarket myself, and I can tell you within the past week and a half, it has been nuts. Who are the high-risk people? The CDC has mentioned that older adults and people of any age who have a serious underlying medical conditions are the people at risk for it. This makes it harder for the people who have to work in the essential places in order to survive, such as grocery stores, hospitals, and anything that you might need essential in your life. This is because that they come in contact with the people who are most exposed to it, or they have more of the serious condition where they are at higher risk of carrying it. Work cleanliness is very important when dealing with this pandemic, especially in grocery stores, because you want to make sure that your employers are safe. Who are the workforce higher risk people? First responders, grocery clerks, and nurses are at all a higher risk due to the contact that they make within these people. For the workforce, CDC says personal protective equipment and respiratory protection should be used as part of a suite of strategies to protect personnel, complementing the use of engineering and administrative controls as needed. Within this statement, many companies have been supplying their employees with these personal protections, but oddly enough, the hospitals are running out of them. And that's because a lot of people who are panic buying are overbuying on those things and taking them away from the medical field who actually need them. With the employees risking themselves out to this pandemic, many companies are giving them bonuses. Kroger the other day stated that they are giving part-time workers $150 and full-time $300 just for them being there and everything and exposing themselves to this pandemic. Within the government setting limitations on where you can go and everything, Many people have come across the theory of social distancing. What is social distancing? Social distancing is a theory of keeping space between people. When should it be in practice? It should be practiced when you are in absolutely large places of gathering, or if you absolutely need to go out, such as the grocery store. Please keep your distance. The CDC recommends 6 feet of distance between people. Elias from US Today wrote that recommend only doing outdoor activities with the people in your household. Staying 6 feet away from neighbors or others in public areas. Meaning, if you don't have to go to the grocery store, don't go, because you would be saving the exposure for the employees and for the rest of the people. If you don't have to go anywhere, please stay home. Social distancing would be acted upon when in populated areas again. Example, if you absolutely need to go out, please keep a distance. Also, social distancing is when you are feeling asymptomatic. Asymptomatic is when you are not feeling any of the symptoms that I had stated previously. It means when you're healthy and you have to go out, that is when you would social distance from people. The other option, if you're feeling symptomatic, you would be doing quarantine. What is quarantine? Quarantine is when people feel symptomatic or have been exposed and they should quarantine themselves. What is symptomatic? Symptomatic is when you feel that you are developing the symptoms of the virus. US Today, Ryan Miller wrote that quarantine occurs when a person is believed to have been exposed to a disease, but is not symptomatic according to CDC. For all of this, it creates many problems for students in school, especially the class of 2020, who are trying to graduate. Makes it very difficult for them. And for colleges, we have switched to an online format, which is very new to a lot of people, including myself. Colleges have switched to online classes across the nation. With that, each state's government officials have ordered close times to ensure the virus will be calmed down by the time that classes resume. The state of Michigan made changes to the online schooling that the primary schools have been giving their students. So if they've been taking any online classes, they're not going to qualify for any credit, sadly. Fox 2 Detroit had made a report referring off Governor Whitmer saying, many schools switched to online instructions, but the state says those requirements will not count as time in the classroom. That's because not a lot of people have access to the internet, and you can't hold that against them to getting their education if they don't have access to the internet. That makes it harder and worrisome for the seniors who are supposed to be graduating in the class of 2020 this summer. In conclusion, as the coronavirus continues to spread across Michigan and the United States, but with the precautions that we can take that I have informed you about, we can help slow down this pandemic. As a call to action and issued by Governor Whitmer, as of 11 a.m. this morning, she had given a stay-at-home order. Please stay at home. I urge you to stay at home as much as you can, keeping us who work in the essential places that you need to go for food, health, anything else. And please keep your family as healthy as possible. Thank you.